Lagos, the largest city in Nigeria, a city with a population of 15 million. But this is still only a fraction of Nigeria's 130 million inhabitants. Average life expectancy in Nigeria is just 43 years. Most Nigerians still have no access to basic medical care, a luxury they simply cannot afford. And those who earn enough to receive hospital treatment are not much better off. The standard of healthcare in Nigeria is appalling. Images like these convince the Dutch Farm Access Foundation that radical change is needed. Together with Kees Storm, ex-chairman of the Dutch insurance company Egon, Farm Access developed the idea of the Health Insurance Fund for Africa. At this stage in the project, the insurance will target a total of 115,000 people, but this number will expand in the future. The fund subsidizes part of the medical insurance premium. This provides a cheaper insurance and therefore makes general health care and HIV/AIDS treatment widely available to all levels of society. The program is based on the experience of the workplace programs of companies such as Unilever, Shell, Heineken, and Celtel, who have provided health care schemes for their local employees and families. On October 12, 2006, the Dutch Minister of Development Cooperation, Van Ardenne, decided to support the Health Insurance Fund with 100 million euros in order to increase access to quality basic health care for financially weak groups in Africa. It is the first time public funds are used for health insurance policies.
By the fund that is being launched, the Health Insurance Fund that is now being launched, that program is going to be a really innovative way of bringing donor money in to subsidize these health insurance premiums for this lower end of the population.
Initially, the insurance will be offered to 40,000 market women in Lagos. The intention is to cover an even greater number of women in the future. In Nigeria, the Farm Access Foundation works together with the privately owned company Hygeia, which has been screened by a respected firm of accountants and found to be financially sound. Hygeia has its own network of hospitals in Lagos and contracts throughout the country with more than 200 other clinics and hospitals. The network is still not being used to its full capacity. Kwara State, approximately 1,000 kilometers from Lagos. It is here that we find the Health Insurance Fund's second group of recipients, the farmers of Shonga. Through subsidies, a total of 75,000 farmers will be offered an affordable health insurance. With this insurance policy, the farmers can make use of the Comprehensive Health Center. This was an old, run-down clinic that has been given a complete facelift by Hygeia together with Farm Access.
We came here about 6 months ago, and it was a very different story. In the last 6 months, it has gone through quite an extensive upgrade. The infrastructure, the building itself has been quite well renovated. It also is now staffed. We now have a full-time doctor here and some nurses and community health workers. So now we have a functioning clinic again, which is very pleasing for us.
5 minutes away from Hygeia's modern clinic in Shonga, we encounter a very different situation. This is a maternity clinic. This state of Nigerian healthcare is the reason why programs like the Health Insurance Fund are important for the future of Africa.
We have also been able to showcase this as a way of incentivize the governments, both at the state and the national levels, to look at also scaling up other community-based schemes in such a way where they are also providing some subsidy for the communities who cannot afford the premiums. But on the other side, they are also incentivized to improve and upgrade the existing facilities, healthcare facilities across the country, knowing that there is now a sustainable model to keep them going.